My next guest here in the speaker studio is none other than CEO of National Voices, Jacob Lant. Now, Jacob Lant joined National Voices as Chief Exec in May 2023. He is a committed advocate for working with people accessing health and care services and the wider public to help improve the accessibility. Jacob, welcome to the studio.
Thank you very much.
I'm going to say, looking at your agenda for both today and tomorrow, one of the hardest working people here over the next couple of days. You've been in quite a few sessions already. How's it been this morning for you?
Exhausting. Confed are definitely getting the value out of me. So we've done 2 sessions today, 2 more tomorrow, covering a huge, we're jumping between AI and data through to health inequalities and how you work with patients to improve the NHS. So yeah, a whole range of different stuff.
We're going to dip into each of these sessions briefly, but just tell us a little bit more about your job, exactly what it is.
Yeah, sure.
It involves day to day.
So National Voices, we're a coalition of charities, about 200 members in total, really drawing from, condition-specific charities, the real kind of the well-known ones in the health space, so cancer, diabetes, heart disease, those sorts of things. But we then bring them together with community-focused charities as well, so people working with those affected by homelessness, might be the Gypsy and Traveller community, new migrants, the sorts of people who are suffering the worst health inequalities at the moment, getting the worst experiences and outcomes. We try and kind of bring all those people together in one wonderful melting pot of people with lived experience to try and help policymakers improve the NHS.
So is that what you've been speaking on, or is it
loosely? Lots touched on, as I say, we touched on AI, we touched on co-production, all sorts of different things.
Let's hit up with AI. First session this morning was an AI-driven future, enhancing clinical productivity.
Yeah.
So tell us a little bit more about what was involved in that session and the sort of main topics covered.
So it was like a session from Microsoft to start with. They were showing off their whizzy new, I think it's called ambient listening tool.
Okay.
Effectively, actually, in my briefing for the session, had a really fun run-through demo of the tool with the guy from Microsoft. Basically, it's a thing that listens to your conversation and does smart annotation of the consultation. So the idea is that it takes away the screen and the keyboard away from that interaction between a patient and their clinician, so that the doctor or nurse can spend more time listening to you, providing compassionate care, and one of the common complaints we get from patients is that it can often not feel particularly compassionate in those sorts of clinical situations. It can feel quite clinical, I suppose.
A little bit turned away, typing away while you're...
So it takes away that sort of barrier, which is really interesting. Obviously, there's some big challenges with it, but it was a brave new world type session.
Interesting. And I'd say, did you anything really surprise you about the new tech, or...
Not surprised me, but I was trying to get across that whilst it's got lots of potential, actually, if it's designed solely by sort of medics and tech bros, that it might miss some of the things that patients want to get out of it. So, for example, if it's listening to our conversation, like it says it's listening to our conversation now, it would, because it's designed by clinicians, it would pay attention to the clinical facts of the story. It wouldn't listen, say, to my story about my journey to the GP practice that morning or the hospital, about how difficult I found it to get the bus, or I couldn't afford the taxi or something like that. And actually that contextual information about a patient is really useful to capture, because it tells us something about, they might struggle to access care in future. I might now need to offer them patient transport support. So actually, if you have the software designed by patients, they'll get it to ask different questions. So yeah, it was an interesting topic.
Yeah, and say that would be, is that where your area of expertise comes in then, and to sort of improve that integration, if you like?
Well, yeah, bring patients into the room, because they'll ask questions that doctors and tech people won't. And, I've been working in patient and community voice for 10, 11 years now, and I've never known once it make anything worse. At the very least, the patients and the public will tell you, yeah, it's great, crack on. More likely they'll finesse the idea and make it even better and make sure it works first time. So
I think you're right, because I've spoken to a couple of people today who've mentioned similar things, that they sort of went, we were going to implement these changes, but before we implemented these changes, we actually spoke to the patients, got what they wanted from it, and it wasn't what we were going to do, and it is that conversation before, like you say.
Yeah, it sounds simple, doesn't it? Yeah. Why don't we do it more often? I don't know.
Ask them, speak to them. That's what conversations are about. NHS is about people, helping people, ask the people what they want. we're going to provide better services. So another session you've done, improving lives and reducing disparities, making every interaction count in health and care. Tell us about that one.
Yeah, so that was, I think the idea behind it was supposed to be about prevention. Like, how do we make sure that every interaction we have with a patient, that we're helping them stay healthy and avoid developing health conditions in the future. And so I was talking a bit about how we really need to design the NHS so it works on the terms of the patient. It builds trust with patients. It talks about what they want to talk about. It delivers the outcomes they want, not necessarily what the system wants. So the example I gave was around obesity. So big challenge for the country, big challenge for the health service. It might be that we want to talk to every patient who's overweight and say, well, actually, are you managing it? But if you do that in every single appointment, it creates stigma about people's weight. People might be less likely to come forward for appointments in future.
Yeah.
So we have to be really careful how we have those conversations. So if you have the conversation on the patient's terms, you can generally have a richer conversation, build trust with the patient, and they'll seek help in future when they need it.
Okay, and coming up tomorrow, again, we're going to go try and get through all your sessions. AI help or hindrance for patients? Interesting.
Well,
Interesting
I think
question.
the session with Microsoft this morning was an example of that. I do think AI has potential, but it's not going to be. I don't think it's not going to like cure cancer. It's not going to be predicting health conditions years before symptoms arise. You know, I think it'll be about fixing the basics that go wrong in the health service at the moment. Okay. So it might be using AI to predict people who might struggle to turn up to appointments, for example, and then we can give them a call ahead of time and say, well, what do you need help with your transport? Do you need someone to provide a carer support? Do you need a translator to come with you? So actually, we can use it in fixing some of the real basic things, and I think that'll make a difference to both how care is received by people, but also make it better for clinicians delivering care.
What do you think how well is AI accepted, do you think, from a patient's perspective or from the staff perspective? Are they adopting it fine? Are they happy with it? Or is there a bit of resistance? What's your sort of experience with that?
I think that in the session this morning, I talked about what I refer to as the creepy factor, that sometimes AI is like, what's it doing? What data is it involved? Who's looking at it? All that sort of stuff. And there are definite things we have to be very careful of, because we could make all sorts of if the data going into it is bad, it will make all sorts of bad decisions and exacerbate health inequalities. And I think people are a bit nervous about what the machine is doing. So we need to have very transparent and open conversations with the public and with patients, and take them with us on the journey, involve them in the design of the solutions. And I think that will build confidence in it. And I think when people understand it is more about, it's the admin, the boring admin stuff it's trying to fix, I think people will be more sort of supportive.
Yeah, and I think you're right. I think it's the unknown of new technologies, isn't it? What is it doing? Where's it going? How does it work? And it's probably a lack of understanding, and it will come with time, do you think?
We also need to, that's why you have transparent conversations. I was mentioning that there's currently a big government-funded public engagement exercise on how patient data is used. It's about £1.52 million worth of public engagement exercise. It's huge, but it's because it's important to get it right. If we get it wrong, then we won't be able to use patient data for all sorts of really good research, clinical research purposes, and develop cures of the future. So it's important to have that conversation with the public.
Fantastic. And final question, Jacob.
Yes.
If you get any time that you're not on stage to go and explore the rest of the show, go to the exhibitions, go to any other talks, is there anything you're looking for, sort of key take-homes, or anything you're hoping to take away from the Expo this year?
So I'm just making my way around all the stands. That's what I want to do, and talk to all the National Voices members who are here, or charities and stuff. I saw Breast Cancer Now stand around earlier. The session I wish I could go to, which I can't, tomorrow morning, because it clashes with what I'm doing. My colleague Sarah Sweeney, our Director of Development and Membership, is doing a session with Matthew Taylor in the big hall, the big room, whatever that's called, all about sort of co-production with patients in continuous improvement. I think that'd be really interesting, because it's such a big stage to put that concept on, about how we work with patients to improve the service.
Oh, fantastic. I say, apologies for working you so hard, but
That's fine.
We very
it's my
much
pleasure.
Appreciate your input for now, and I say in all the sessions you've been part of, and thank you very much for coming talking to us in the studio.
Thank you.
Thanks a lot, Jacob, and enjoy the rest of the show.